What are the symptoms of an anterior upper segment placenta?
Hello and welcome to today's video where we'll be discussing the anterior upper segment placenta, what it is and the potential symptoms. An anterior upper segment placenta refers to the location of the placenta inside the uterus during pregnancy. Specifically, it is attached to the front, anterior, and upper portion of the uterus.
What is an anterior upper segment placenta?
During pregnancy, the placenta can attach itself anywhere within the uterus. It plays a vital role in supplying the fetus with nutrients and oxygen via the umbilical cord. The position of the placenta is usually determined through an ultrasound scan. When the placenta is attached to the anterior or front wall of the uterus, and specifically towards the upper part, it's referred to as an anterior upper segment placenta.
What are the symptoms?
In general, the position of the placenta doesn't usually cause noticeable symptoms. As such, an anterior upper segment placenta often doesn't present any specific symptoms or problems and is typically a normal finding on an ultrasound scan. However, in some circumstances, the placental position can have an effect on pregnancy and delivery. It is worth mentioning that regardless of the placental position, certain symptoms could indicate issues related to the placenta, and these include 1. Vaginal bleeding. Any significant or continuous vaginal bleeding during pregnancy should be evaluated immediately as it could be a sign of placental issues. 2. Abdominal pain or cramps. Severe or persistent pain could indicate a placental problem. 3. Baby is not moving as much. Changes in your baby's usual patterns of movement could be a sign of distress, which may be related to placental function.
Does it impact delivery?
In most cases, an anterior upper segment placenta does not affect the delivery process. It is not associated with complications like placenta previa, where the placenta covers the cervix. Nevertheless, it could potentially make certain aspects of monitoring the baby during labor slightly more challenging. For instance, it might be a bit harder to feel the baby's movements or to get a good reading on external fetal heart rate monitors. To conclude, having an anterior upper segment placenta is usually a normal finding in pregnancy and does not present any specific symptoms or issues. Nevertheless, always pay close attention to any changes in your body during pregnancy and promptly seek medical attention if you notice any unusual symptoms. I hope this video has been helpful, and as always, don't hesitate to reach out to your healthcare provider if you have any further questions or concerns.